Recording is on.
Good morning, good afternoon, good evening, everyone, and welcome to our special session on MEG's AI capabilities. Today, we are unlocking a behind-the-scenes look at how artificial intelligence is powering smarter, faster, and more intuitive solutions across healthcare. Thank you for joining us as we dive into the innovative world of MEG. AI is transforming what's possible in our platform, and we're excited to show you both what's here now and what's coming next. It's a pleasure to host you all for this deep dive into MEG's AI journey. Whether you are here for inspiration or practical insights, you are in the right place. To take us through this exciting landscape, I'm delighted to introduce my colleague Manasi, who will guide us through MEG's latest AI feature and our ambitious roadmap.
Thank you, Mahmood. Let me share my screen. Hope you guys can see my screen.
You can see it. Go ahead.
Thank you. So today we will dive into MEG's AI capabilities. The structure of today's presentation would be, I will walk you through some of the features that MEG has implemented, followed by a live demo of the features. And there will be a small outro followed by the Q&A. So if you have any questions, please feel free to ask. Let's begin. The first feature is auto title field. An automated title field is a feature that is automatically used to summarize your text into a descriptive title as soon as you submit your data. This saves you time by capturing the main idea from one of the key fields automatically, so you don't have to label reports yourselves. An example use case would be on October 27th and at approximately 2:30 p.m., a contractor performing maintenance on the HVAC system in Building C failed to properly secure a ladder. The ladder fell, causing minor damage to a potted plant and a small dent in the drywall. No one was injured. The contractor was immediately informed of the safety violation, and a new procedure was implemented for securing ladders for all future work. So, for the incident, an automated title would look something like HVAC contractor safety violation in Building C. This will be generated using AI. The next feature is auto categorization. This feature utilizes large language models, LLMs, to automate the classification and tagging of unstructured data, such as incident reports and patient feedback. This functionality assigns a suggested category to each entry, improving information retrieval, analysis, and workflow efficiency by automatically routing specific categories to relevant teams for timely actions. An example of this would be an incident report describing a medication error is automatically categorized as medication and routed directly to the pharmacy team for review and response, bypassing the need for manual triage by the quality team. Or a patient feedback that specifically mentions cleanliness is automatically categorized and routed to the cleaning staff, enabling them to address the issue promptly and directly. The next feature is sentiment analysis. This feature utilizes natural language processing to evaluate textual data, such as patient feedback or staff comments, to determine the emotional tone and subjective opinions. The functionality provides actionable insights into patient and staff perceptions, enabling organizations to address underlying concerns and improve communications. The system automatically assigns a suggested sentiment, such as positive, negative, or neutral, to text fields, facilitating rapid identification of critical feedback. The key differentiation here between the other systems, the traditional ones and MEG system, is that the sentiment is decided through context, not just keywords. For example, an alert is configured to notify quality managers of all feedback entries that have been automatically classified as having a negative sentiment, enabling immediate review and response to address potential patient or staff dissatisfaction. An example of this would be A patient left feedback stating, I have had better food than this, but it was slightly okay. The system does not just read the text by keywords such as better or slightly good, rather by context that they have had better food than this. The next feature is voice to text reporting. This feature uses LLM powered speech recognition, letting users speak data directly into the QMS. Forget manual typing, it saves time and boosts efficiency, especially when hands free reporting and typing is required. The LLM accurately turns spoken language into text, even with different accents or speaking styles. This makes data entry easier for everybody. An example of it would be a healthcare professional can verbally describe an incident, and the LLM will convert their spoken description directly into the incident description text field of the report. Or during a patient interview, a staff member can speak the patient's feedback, and the LLM will transcribe it directly into the patient comments text field. The next feature is document querying. An integrated AI agent within MEG Docs provides users with conversational and efficient way to query the document they are currently reading. By leveraging a deep contextual understanding of the content, the AI can deliver direct, relevant, and accurate answers to a variety of questions, ranging from specific fact retrieval or summarization. This feature enhances the user's interaction with the document, allowing them to quickly find and comprehend information without ever leaving the reading interface itself. An example would be a nurse is renewing a hospital infections control policy and needs to confirm the protocol for a specific procedure. They ask, what is the proper hand washing procedure before administering medication? The AI agent navigates the policy document, finds the relevant section, and responds with a concise answer like, according to the policy, hands must be washed for at least 20 seconds with soap and water or alcohol based sanitizer before any patient contact or medication administration. Another example would be a medical assistant is reviewing a document on billing procedures and needs to know the correct code for a specific service. They type, what is the CPT code for a routine physical exam for a new patient? The AI agent searches the billing guide and provides the correct code and brief description. For example, the CPT code for a routine physical exam for a new patient is 99203, as detailed in the routine visits section of the billing handbook. This saves time and makes it easier to keep track of what's what. Now, I'll walk you through a live demo of the system. This is one of the forms which has some of the fields that we discussed. I'll add data to it. For audio, I'll speak out the situation. An X-ray technician ignored my request to handle me with care because of my broken leg. They were hasty and it caused me a lot of pain. The audio is now saved. As you can see, the form is now submitted. The data in the backend will now be processed by AI to generate correct output, to assign a correct category, and to summarize the content. We have implemented another feature to dynamically translate some of the fields using AI into different languages. So, for example, today we'll see the dynamic translation from English to Spanish. Now, in the backend, what usually happens is when a user logs in to review the data, this is how they will navigate. Let's look for the same form. I'll go to the review screen, open today's observation. As you can see, the data is now classified. The category is management. The dynamic classification happens in Spanish. The title has been generated, stating that the bathroom cleaning request was ignored. Sentiment has also been understood. As you can see, it's not keyword based because there are words like better, and the audio has been transcribed correctly. The next part of the demo is to navigate through the LLM document based querying. So I'll ask the document to summarize. As you can see, the document has been summarized.
Sorry, Manas, to interrupt. Just to help people with enlarging the screen because it became small.
Ah,
If you could
okay.
just, it should go.
Is it better now?
No, it's not from the inside.
As you can see, the AI elaborates what the common use cases are and how the users can use this document. In the summary, it also states how the users can access the system, and based on the contents, the outputs are generated. The key feature about the querying of the document is it always stays in the context. It never elaborates or goes out of the context answering any questions that are beyond uh, the document scope. So the only responses you will receive from AI is related to that particular document. It's secured and relevant. So,
Thank you for joining today's session. Before we close, let's take a quick look back at what we explored today. We walked through how MEG's AI brings intelligence into every step of reporting and feedback, so here's a quick recap. We started with how MEG auto-generates clear, concise titles from long incident descriptions, making reports easier to understand and track. Then we saw how smart categorization automatically routes complaints and feedback to the right team, pharmacy, cleaning, or quality, without any manual triage. We looked at how sentiment analysis goes beyond keywords, detecting tone and context so negative feedback is flagged instantly for review. Next, we explored how voice-to-text reporting lets staff speak incidents or patient comments, with MEG transcribing them directly into structured records. And finally, we saw how document querying enables staff to ask natural questions of policies or procedures and get instant, accurate answers without digging through pages of text.
that's all for today's session. In case if you guys have any questions, happy to help.
Thank you, Manasi. We actually received some common questions, if you could answer them. It's the first one we got. How does MEG's approach for sentiment analysis differ from standard keyword-based analysis?
Um, so the primary difference between the traditional systems versus MEG is that it is based on context. It does not only answer the questions based on keywords or categorize data based on keywords. It understands the sentiment behind it and the context in which particular sentence has been said or written.
Very clear. The next one says, how does the automated title feature determine what information is most important to include in the title?
So the way it works is based on the prompt provided in the backend. The prompt lays out the information about the system, what the context is, and how the data is to be perceived. It's very simple to configure, and if the system updates, the auto title field will update accordingly. So it lies in the prompt and the training the model has been provided with.
And how can we customize the suggested categories the module assigned during category assignment?
Oh, absolutely. The categories are fully customizable. In the example that I just showed, those categories were relevant to my context, but we can add as many categories as necessary and any number of categories required. It depends on what the use case is and how much the data will the data is classified into the categories basically, and yeah, it's fully customizable.
And Simi is asking, in terms of transcription, will MEG AI be able to tell between the patient and the nurse during the conversation for auto reporting?
So AI can definitely detect the conversation, and if we have enabled the audio will be inputted as is. So whether it's a conversation or if it's patient elaborating their experience or just a nurse laying out a scenario, that's completely possible.
Right. If you have any more questions, please keep them coming in the chat. If not, then thank you all for your attention and engagement today. You receive the recording to your email after the meeting. And if you are as excited as we are about the future of AI and MEG, stay tuned. There's a lot more innovation ahead. That wraps up today's session on MEG's AI capabilities. Thank you again to Manasi and to all of you for your participation. We look forward to helping you unlock even more value with MEG's evolving technology. We appreciate your questions, your curiosity, and your commitment to healthcare innovation. Keep an eye out for updates from our team, and don't hesitate to reach out if you want to continue the conversation. That being said, have a good day.